Hi, everyone. Welcome to Good Gig, a podcast where we celebrate jobs and careers. I'm your host, Frank Stewart, and I'm here today with my buddy, Jay Anseth, as usual, as well as our guest for today. Our guest today is Shawna Ross. Shawna is a speech language pathologist and founder and owner of the Sierra Therapy Group in the beautiful city of Reno, Nevada, the biggest little city in the world. Shawna specializes in child language disorders, specifically those associated with autism. She's here today to talk to us about the field of speech pathology in general, as well as what life is like on a daily basis in that field and how she got into the field. It's a real pleasure to be able to welcome Shawna to the podcast. Shawna, Jay, it's great to see you.
Hi.
Frank. So we are recording this in late December. I'm in Bozeman, Montana. Jay is in Boston, and Shawna, as I mentioned in the introduction, is in the beautiful city of Reno, Nevada. How are things in Reno at the moment, Shawna?
Oh, right now it is sunny and blue skies. We had some snow over the weekend. We live in the foothills, so we had about 6 inches. So that was always fun and exciting. And now it's just kind of cold and dry. So waiting for another storm.
That sounds exactly like Montana at the moment. We had a nice snow cover. It looked like it was going to be a beautiful white Christmas, and then yesterday it warmed up into the mid 40s and 50s, and with 50 and 60-mile-per-hour winds. So it either melted all the snow or it blew it away. Anyway, well, Merry Christmas, Merry early Christmas to both of you. As I said in the introduction, Shawna is a speech pathologist, and I guess I would like to start the discussion, Shawna, with just a few words from you about what a speech pathologist is specifically or generally. Like, how would you describe what you do to somebody who has never heard that term before?
Yeah, it's always surprising. I've been doing some more advocacy work, and our lobbyist always tells us, like, even though we assume everybody knows what we do, so many people don't really realize what we do. A lot of times, people will say, "Oh, you can help me with my stutter," or "Oh, I you probably are listening to how I sound." But the scope of practice is so much bigger than that. So to be a licensed and certified speech pathologist, you have to have a master's degree, and through that training, you learn how to evaluate and treat children and adults across the lifespan. So, there are speech pathologists that work with babies in the NICU on feeding and swallowing, all the way up to end of life care with swallowing again or communication. Um, for example, for adults who have had strokes or traumatic brain injury, that there's that realm. I am a pediatric speech and language pathologist, and so I really focus on kids. But again, my scope is quite large. I see kids from age 2 all the way up to my oldest right now is 24.
Oh,
So
wow.
I work with kids on how they're saying their speech sounds. I do have a few kids who stutter. I also have a real interest in helping people who have autism and social communication disorders, and just some higher level language processing executive functions. So you can really specialize or you can be broad. It is a lot to know across the lifespan. So, my first year out of graduate school, I worked at a practice that saw kids and adults, and I felt very spread thin. And my true passion is working with kids and the families.
So I guess my next question, after you've defined what a speech pathologist is how did you choose this field? I I've known you for a while now, and I should back up and provide one more piece of information. Shauna is, for lack of a better term, a high achiever. So she was the top in her class in college. So had the grade point average, the highest grade point average of anybody in her class in college, which is impressive. And correct me if I'm wrong, Shauna, I think you went almost immediately from undergrad into your master's training.
You're
So I
embarrassing
guess
me.
I'm describing someone who probably could have gone in any direction professionally, but it seems like from a pretty early age that you were focused on speech pathology, and that was your major, correct, in college?
Yes, but there is a little bit of a backstory. So, as a freshman, in college, I was declared my major was biochemistry actually. I thought I wanted to go to medical school. And so as part of that, I joined the biochem club. And I was sitting in biochem club and there was a guest speaker. And I realized that if I didn't get into medical school, I might be in the lab by myself. And I decided I wanted more interaction with people, which might be a misconception about that field at all. But when I was a freshman in college, that was my perception. And so I met with a career counselor at UNR, and she told me about speech pathology. I was maybe considering nursing too, but then decided I didn't like blood, all these things as you try and figure yourself out in early college. And so the career counselor, again, told me about speech pathology. I hadn't really heard about it. I had heard the term, but I didn't know much. And I took the introduction class that next semester and I fell in love with it. And so that was as a sophomore. And at that point, I knew it's what I wanted to do and that the next step was going to be graduate school. So that is kind of how I found speech pathology. And then, I guess next step, I did consider going on to higher education. So, out of college, you have to do a clinical fellowship year under supervision, and I did that at another private practice. And at that point, one of my professors and mentors, who I'm actually having dinner with tonight, she was really advocating for me to go on and go into higher education. There is a lack of professors and people going into higher education within speech pathology. I don't know if that is within other professions as well. And so I started exploring that a little bit. And then at the same time, another colleague kind of reached out to me and asked if I wanted to start a private practice. And so, like I said, at the first private practice I was working at, I felt spread thin, seeing adults and kids. And she came to me and I said, yes, let's do that. And so my path went that way. And I do sometimes wonder what would have happened if I had gone the other way. And I, without doubt, tonight when I have dinner with my mentor, she's probably going to ask me if I still want to.
I
So,
guess it's never too late for anything. Yeah, but it seems like this has worked out really well for you.
yeah, yes.
So the class that you took that you said you kind of immediately fell in love with it, what was it? Was it the ability to kind of help people and overcoming their issues, or was there something specific that resonated with you?
That was a long time ago. So let
Yeah.
me think. What I loved, I forgot to mention that the speech pathology department is within the School of Medicine at UNR. So I love that I was still sort of connected to that medical piece. I loved learning about the brain and how it affects our speech and language and what happens if you have acquired brain injury or a stroke. So I love that medical aspect of it. And then, yes, learning about development and typical development and how we could help people. That probably was a huge piece of it. I was just doing, I just went to the ASHA convention, which is the American Speech and Hearing Association's national convention. And I think I already mentioned this. I'm doing a lot of advocacy work right now. I've kind of shifted into that within the past, like since 2019, so 5 years.
Hmm.
And I was talking to somebody and I realized that my mom was kind of a behind the scenes influence on this that I hadn't really realized until I was talking to somebody. So growing up, my mom was she worked for the schools and she volunteered with the PTA and she was always involved with that sort of a thing. So I think hindsight, it was probably my family too that kind of got me into the helping profession.
So I want to dig a little bit more specifically into the education side of things. So your major was in speech pathology, and so that presumably equipped you very well to go on and do a master's in the field, right? But I went to a school that basically had biology, chemistry, and physics as science majors, right? So there was nothing specialized. Do you have a sense of how common it is that a speech pathology major exists at an institution? And I guess the second part of that, if it doesn't exist, like what's the best undergraduate training to then get you into an MS program in speech pathology?
Okay. Yeah. I don't know, like in regard to what schools offer speech pathology and audiology. That was also part of my undergraduate training as a undergraduate program. But there is an avenue if you're at a school that doesn't have a speech pathology undergraduate program. So you can apply to graduate programs as a graduate special, and you might have to take some prerequisite classes if those were not part of your degree. But you can apply to a grad special training program and then apply to graduate school. It
Okay.
just lengthens the program a little bit.
Okay. So there is an avenue for folks that didn't come into this interest as an undergraduate, but discover it later.
Yes,
Okay.
yes. And also, an area of the field that is growing right now that wasn't really an option, at least in Nevada, is something called an SLPA, and those are speech language pathology assistants. And so that is where you can, I think that they're looking at 2 or 4 year programs for that. And you would be certified in a sense. And each state has a different setup for that. Nevada is a little bit behind the game in recognizing SLPAs. But I know in California, they are recognized and can be employed. And so the difference between that and just having your undergraduate in something like speech pathology. So, as a bachelor's level degree, our training only included typical development. And so, that next SLPA piece or graduate school is where you get the training on delays, disorders, assessment, and like really how to be a practitioner. So that is why there's that avenue too. And so in Nevada, we have a huge shortage of speech pathologists. I think we are ranked 49th in the nation per capita of
Wow.
speech pathologists per capita for our population, and especially in Clark County. The Clark County School District has, it's always been a struggle for them to find enough speech pathologists to work with the kids. And so for a very long time, the University of Nevada, Reno was the only program in the state to offer speech pathology. And now there's a newer college in Vegas that also has a program, Nevada State College, I think is what it's called.
Okay.
So there are programs that are growing and developing.
Do you have a sense of why that shortage exists specifically in Nevada? Is it because it's a rapidly growing state and there's just not the training infrastructure, or there's some other
I mean,
reason?
I do think that that was part of it, right? Yes. And graduate programs only accept a certain amount of people each year. And
Okay.
so the need is growing. Yeah, the population probably is growing faster than the ability to train clinicians. And then getting people to move to Nevada, especially the rural areas, is also difficult. So
Yeah, so related to that, so do you think that there is a growing demand? Like, do you see like in your practice, maybe more on the developmental side, that the elementary school level kids, there's more and more of a need for this?
off the
Like
cuff, yes. Yes,
like
off
per
the
like
cuff.
per like per like if you were to normalize it, like per capita, or do you think it's I just didn't know if it was becoming more of an issue or
I think off the cuff, yes, but also with our aging population,
mm,
that is also increasing the need as that generation of adults is aging, especially in regard to audiology and hearing loss.
I
So
see.
that's another piece of the training. So as an undergrad, I did get training in audiology, but then you have to now get your doctorate to be a practicing audiologist. So it's another avenue within this field. And then in regard to developmental changes post COVID, there are studies now showing that kids are showing delays in their development. They're not calling it disorders yet because it could just be differences, but where gross motor and fine motor skills have caught up, the communication skills have still lagged. And so that time during COVID when kids were not out as much, interacting at the park, in the grocery stores, in preschools, and with masks on and not seeing people's face, the research is now showing that it has had an effect on kids. And so my guess is in the next couple of years, as these kids hit school, we're going to continue to see kids who have some different needs than we're used to.
Does that mean that kids actually learn how to speak by watching how other people move their mouths? Is that
I mean, that is a piece of it, yeah.
yeah,
Yeah, the nonverbal communication piece, yeah.
yeah, yeah. And then this is just because I've never really thought about this. So for the elderly population, for those people whose hearing is failing them, or they have a shift in their ability to hear, that does impact their speaking ability?
So it affects their communication. So
Communicate.
they
Okay.
might be able to speak clearly, but it can lead to social isolation
Okay.
because, like, say you're in a noisy restaurant and you have hearing loss, and you then don't connect with the people that you're with, you might not like that and like how that feels. So then you don't go out as much anymore. So it can really affect communication and social use of language.
Yeah, that's really interesting, especially that connection between vision and speech development. Is that something that is part of your practice as well? Do you deal with with children with vision impairments that consequentially have speech impediments because of that?
Not so much like cause and effect,
Yeah.
but we do see kids who might have a genetic disorder that is affecting them globally. So I think not so much a vision impairment is what impacted kids during COVID. I think it was the not being out in social situations and not seeing the social cues. It's bigger than just a vision acuity.
So sorry, I want to get back to the educational training component of it because
Oh,
I
yeah.
think students will be interested in what specifically the master's program might look like. Can you talk a little bit about what length of that program is and what the training in the program involves? Presumably a mixture of classes and clinical time, or
Yes.
okay.
So I can speak to what the university here in Reno does, and this was a long time ago, so things have changed a little bit. But it was a 2-year program, and we started out with all classes the first semester, where we took classes focused in both children and adults. And then in the second semester, we were paired up with professors and you were put on an evaluation team and you did evaluations during that semester, which included planning for the evaluation, gathering case history, making a plan for the evaluation, conducting the evaluation, and then writing a report. So you were on a team that did that. And then we were also assigned training clients that attended the speech and hearing clinic at the university. And that was such a great learning experience because our supervisors were there 100% of the time, at least in the beginning, sitting behind a two-way mirror, either giving us feedback afterwards, or sometimes they might need to come in and help us. And
Okay.
so we really got hands-on training that way. And then after, all the while we were still taking classes. And then the summer was a little lighter, but we did continue with clients at the clinic and then moved into the next year, the fall, our second year, and we were placed in externships. And so I did an externship in the school district. I was placed with a person who was at a year-round school, and so part of my placement was during one of their tracks that was off. And so while that school was off, I went to a program called Child Find, and it is a federally mandated program for kids between the ages of 3 and 6. And so before the age of 3, there's early intervention services, which is also a federally funded program. And so clinicians, SLPs, and developmental specialists work with kids from birth to 2 or birth to 3, and then they can transition to the school district 3 to 6. But to qualify for that, they have to meet certain eligibility requirements. And so for those 3 weeks, I was at Child Find, and I really loved that part of the externship. And then my second placement was at the private practice I actually went to work for after I graduated. And so it was called the Continuum because they worked with kids from preschool and all the way up to adults. They even had an adult day program. So there are sometimes situations where adults have disabilities and they're not safe to be left at home, but they're not to a point where they need assisted living. And so it was a place for families to send their loved ones during the day so that they weren't home. And we would push in to that program and do therapy with them. I learned a lot with that program and being at that job. Also, as part of the requirements to graduate, you have to pass a national exam. It's called the Praxis. And students either had to do comprehensive exams through the department or a thesis. There were two options. So I went the thesis route, which is part of the reason why maybe I didn't want to go into academia. I loved the data collection part, which was working with the kids, but I didn't love the data analysis as much.
So is that, you said it was the Praxis exam?
Yeah, the Praxis. Yeah, that's the
Is
national exam. Yeah.
that effectively a licensing exam, or is there a second licensing step that comes later?
That is part of the licensing step. So
Okay.
you have to pass that as a piece of your training. So you have to have the master's degree, you have to pass the Praxis exam, and you have to do your clinical fellowship year to be licensed in Nevada. Other states have different rules. So that's changing a little bit. And then also, in addition to holding my license, so I have a license to practice in the state of Nevada. If I wanted to do telehealth or go to another state to work, I would have to be licensed in that state as well. But we are also certified through the American Speech and Hearing Association. So I also hold it's called the Certificate of Clinical Competence, my Cs. So, and for that, I have to complete a certain amount of continuing education hours per year and agree to abide by a code of ethics.
Is it common that one's first job out of the master's stems from their externship? Like, do those connections usually lead to a position?
Yes and no. I mean, at least here in Reno, a lot of the people that I hired in my private practice along the years were students that we had.
So you administer your own it's called the Sierra Therapy Group, and it's a group of speech therapists, speech pathologists. So you would be looking for folks to hire that were right out of their masters, or what's the typical person that you would hire into your group?
We are open always to having people who are going into their clinical fellowship year.
Okay.
So right out of graduate school, we have also hired people who have had more experience and who wanted to change settings. There was one person who worked for the hospital for many years and wanted a change of pace, and she came and worked for us. I think what we look for mostly, or what I look for mostly, is somebody who really wants this practice setting and who understands kind of the rigor and the differences between strengths and maybe barriers or frustrations with this practice setting versus, say, a school district or the hospital setting.
So are those kind of the three arenas that most trained pathologists go into, either a private practice, a school setting, or a
Hospitals.
hospital? So
There's also skilled nursing facilities, which is, kind of under the hospital avenue. And also, there's home health. There are some clinicians who do home health. And then there's the early intervention piece. And that is a lot of parent training and home visits. So, yeah. So really, there's so many avenues.
So I'm really curious now to talk a little bit about life on a kind of daily basis. Like what what does the job actually entail? Like what do you spend most of your time doing? And maybe along those same lines, what are the skill sets or personal attributes that you think would make somebody really successful at what you do on a daily basis?
So, over the years, my role has shifted and changed. So, I'll go back a little bit. And so, when we when I first started the private practice, I had a business partner and it was just the two of us. And our hours were long. And in private practice, you only get paid, you can only bill when you see people. So it's direct client contact. So we don't quote unquote get paid for the paperwork time or the treatment planning time. So in order to really be successful, you have to have a willingness to see people and have that hold that schedule. Um, it's that differs from the school district where it's more of a salary type of situation with benefits. So we started off, when it was just the 2 of us, we did everything. We we scheduled the clients, we provided the therapy, we did marketing, we even did our own cleaning because that is where we were at until we were successful enough and knew what we're doing. We taught ourselves all of the billing and insurance benefits tracking and contracting and credentialing with insurance companies. And I wouldn't go back and change it. You can pay people to do that. There are companies that will do that for you, that will take a percentage of your reimbursement rate. But it was invaluable for me to know that side of it and to be able to make decisions down the road as a business person knowing that. As we grow, we hired our first, or as we grew, we hired our first employee. And that was wonderful to see that what we were building was able to serve more families and kids. And then we weathered our first insurance cut. And so Medicaid cut our rate by, it was about 30%. So they used to provide a pediatric enhancement rate through Nevada Medicaid. And due to budget reasons, they stopped it pretty much on a dime, which means we really had to pivot. And at that point, we were paying our employee and we were not getting paid. And so my business partner at the time decided that she didn't really want to move forward and deal with these sorts of things that might come our way. And so we parted ways and I continued on. I had a really big talk with my husband. My husband has been a huge help on the business side of it. And so kind of what we have built has been a lot of his business mind and then my therapy mind and working lots of hours in the beginning. um,
Well,
so we,
sorry to
yeah,
interrupt you, but
yeah.
before you get too far past the point. So you said two things a little bit ago that I'm very interested in. That the marketing side of it, and then scheduling clients. So I assume all your business is referrals. Like when you're starting out a private practice, how do you go about just establishing that or just getting known to the point where you get referrals? And what type of marketing are you doing? Like how does that work?
Yeah, that's a really great question. So I have the benefit of staying in the community that I've been in for so long. So I did both my undergraduate and graduate training at the university at here in Reno, and there were only two other private practices in Reno that were seeing kids at the time, and even then there was still a huge need. For these kids to get private services in addition to school-based services. And so the university was a huge referral source. So when they couldn't get kids into their training program or they weren't the right training clients, they really did refer a lot of people to us and just relationships, really. And I would go to doctors' offices and drop off flyers. Um, uh, Facebook marketing was not really a thing yet. And I don't know if it's changed like over the years, but it was kind of looked down upon to do any direct marketing within the medical field. So a lot of it was just education about when to refer kids, what to look for. A lot of the pediatricians, and we still sometimes hear this, will say, "Oh, just wait and see, they're okay." And so I did also write a few blogs that we put on the website. We developed a website. And then as Facebook started to grow, we did use Facebook a little bit. Um, and really also families word of mouth was huge.
Yeah.
So, did that answer it?
Yeah, that was really good. And I assume now that so how long have you had your practice?
Almost 19 years.
Yeah, so I assume that that part of it, it's almost automatic now. It just kinda runs itself
Yes.
in terms of
Yeah. Yeah. I mean, yeah, actually. It does. We rotate weeks now about who takes the intake calls. And last week, December's usually a slow month for intakes, just with the holidays and everything. And I had, I'm just looking at my notes. I had 6 calls and 3 faxes from doctors, and that was just last week alone.
And then on a logistics side, do you have to go everything through insurance, or do you have the ability to do out of pocket, or is that just there's just not much of a market for that?
So if you are contracted with that insurance company that the family has, we're required to bill it. But I'm not contracted with all insurance companies for a number of reasons. So if parents do want to pay privately, they can. And also, if their insurance doesn't cover, or say they only cover 12 visits a year and we need to keep going, they have the ability to cover or to pay out of pocket. In Reno, with our with the community here, there are people that can do that. I think in some communities, people can build cash pay practices. And with some of the insurance headaches and barriers that we're facing, there are clinicians who are moving that direction. For the time being, I am not going to move that direction because I really value the help I can give to some of the families who wouldn't be able to pay that cash rate consistently. So yes, it's an option.
Yeah, it's tricky because we had this kind of question with on a different session, just kind of in situation, especially like when you're on your own, like you are, and you're providing value, like significant value to people. Like I can imagine the difficulty assigning the price, like how to charge that. And in your situation, you also are it's kind of conflated by these insurance rates that you can work within, and it kind of makes things more difficult. I could imagine. So
Yeah. Yeah. It's a unique situation for us because there are other medical professionals and say, for example, neuropsychologists. I don't know how much you know about a neuropsychologist,
oh,
but they only see kids for maybe 3 to 5 sessions to get their testing done and make their recommendations. When the kids are receiving therapy, speech and language therapy, we see them. I mean, our recommendation is once or twice per week. And so,
mm,
yeah, that it's a different financial choice. We are at a place with the need here in Reno that the intake calls we take, the parents are very anxious, and it's one of the hardest parts of my job right now is taking these calls and fielding these calls, knowing that we could help them, but we don't have the room to help them, and knowing that their kids really do need this help right now. So, yeah.
So if I'm kind of hearing things correctly, you're kind of an atypical speech pathologist in the sense that you really have the building the business side of things layered heavily on top of your work as a therapist. And correct me if I'm saying anything that's incorrect, but I would imagine that, the first few years, it was a real rat's race to try to do both of those until you started hiring other folks who could take more of the therapy role. Is that true? Has it really shifted so that now you're more of the businesswoman, more of the administrator?
Yeah, I'll go back. So, in the beginning, our days were so long. Because I would see kids full time. At that point, we were doing 5-day, like 8 to 5 work days, and then we would do the business stuff in the evenings and on the weekends. And so, I mean, I was younger then, and I really wanted it to be successful, and I did truly love the therapy part of it. And then we grew more, hired more people. We also added occupational therapy into the practice,
mm.
which was a learning curve for me because then I was supervising somebody that wasn't a speech pathologist. But I really was able to put in some systems on turnaround for reports and notes, and like I can manage that. So as we grew and as my family grew, I really was not doing direct therapy. I was doing most of the business stuff so that I wasn't working a million hours when I had my young kids. And we started training people to do the billing and insurance part of that. And currently even today, my sister-in-law does the billing for us. So we're very fortunate with that. And then fast forward a little bit, I was not loving managing people as much. And I really found that people would come to the private practice for a couple years and then for a number of reasons would transition to another setting. And so that got to be very stressful because they would have full caseloads of people who needed therapy, and there was nowhere else in Reno for them to go. And it got a bit harder to hire people. And then also, as the insurance reimbursement rates have not increased, there's only so much that we can reimburse and pay somebody to work as an employee. And so I was at a point where I wanted to see more kids again. And Ryan and Brian's my husband, we really started trying to figure out what the next step was going to be. Was it just going to be me on my own doing cash pay? Was I going to go back to school? I didn't really want to go to the school district. There are some barriers with the school district that I know I would not be happy with, and it would not bring me joy to go to the school district, even though there are people who do an amazing job in the school district, and the schedule is great, the salary is great, the benefits are great. So there's a number of reasons to go into a school-based setting. So in 2017, we decided to change the business model, and we we kind of run it like a hair salon now. So each of the clinicians rents office space
Hmm.
from us, and they run their own practices now, all under the umbrella of Sierra Therapy Group. So we
Okay.
still have our referral stream that I built and we built for years and years. And each person has flexibility. They have the potential to make more money. And I helped train and transition all of that for them. And so that has been going really well. And now I'm back seeing like two-thirds of a caseload. So I am not quite full-time because my boys are still really busy right now.
Yeah, that's amazing. I think that's an incredible story, Shawna. I mean, this is, like I said, not to be too repetitive here, but this is not what I was envisioning the discussion being about, which is great. But you
Hopefully
really
you
are
can use it.
balancing.
Hopefully.
No, no, this is
Okay.
perfect. Like, because it's even more inspirational because this is really a story about, yes, being a therapist, but also being a small business person and making that work as well. And those are two separate things. And I would imagine the skill sets needed for both of them don't necessarily overlap.
So can I answer one of the previous questions because I think I didn't answer it directly. I think one of you asked like what a typical day looks like, and I went off on a tangent. But like a typical day in my clinic entails starting at between 8 and 9, and seeing kids for either 45-minute sessions or 30-minute sessions, depending on their needs. And then having a break at lunch, and then the clinicians who are full time start after lunch and go until about 6 o'clock. And many of the clinicians in the office do a 4-day work week. And so when the other tasks that we need to do, we do daily notes for each of the kids. We write initial reports and progress reports. We try and do them every 6 months, but right now I'm very far behind. I'm hoping to get caught up in the next couple weeks. I actually have a graduate student starting with me in January for an externship. So I need to get a little organized before she gets here. So that is how that works. So you also have to have a strength of having some energy to jump in if you have a cancellation, because we do get cancellations. And when those happen, that's your time to kind of get your paperwork done. Or be okay knowing that you might have to take it home if you can't get buckled down and working. And then is also the task of requesting prior authorization. So some of the kids, we have to request authorization through their insurance to be approved for the sessions. And so that usually entails an online form and attaching notes and reports. Sometimes, though, when they do not deny the services, we then have to file appeals and do peer-to-peer calls with somebody with the insurance company.
I would be exhausted by that, to be honest. Like nonstop social interaction exhausts me to an extent. Like, so I would imagine you really have to be the right type of person to have the energy. You mentioned energy, but that's not going to be a formula that works for everyone.
Right. Yes. Yes. And we sometimes also have to have hard, difficult conversations. Most recently, I'm working with a little 2-year-old. I believe he's 2. And his progress so far it's been pretty slow. He's making progress. And so I brought up the diagnosis of apraxia with the parents this week. And now, with parents being able to research everything on their own so much, they've read a little bit about apraxia. And then in the back of my head is a diagnosis of autism too. And so I have sometimes been the first person to talk to parents about these diagnoses that are heavy for families. So that doesn't happen all the time, but it's something that will be experienced if you work with kids. So yeah, and so when I work with the kids, I do work with a variety of things. So I'm just looking at my schedule. So for example, on Tuesday, I start with a little girl before she went to school who can't say her R's. And so that was just a lot of drill, trying to get her mouth in the right position, giving feedback. And then I ran over to a preschool. I go to a preschool sometimes too. And I saw a little preschooler who's having trouble with some of her speech sounds. So she might say tar for star, or she's also doing something called fronting. So she's saying like dup for cup. And then she's doing pronoun errors. So him is wearing a hat. So we work on that. I really use a play-based model and a child-directed model. So I incorporate working on these things with games, play, books. This week, I was able to tailor most of my activities around one Christmas tree activity. So it's a Sierra Therapy Group tradition, but I take an ice cream cone and we put it on a plate and we put green frosting on the ice cream cone and then we decorate it with candy to make a Christmas tree. And so I was able to work on the R's, the language. I was able to work on sequencing and then also having the kids tell me back how they made it using language forms. So that was in terms of having energy. Like sometimes you have to take a few minutes to have one activity so you're not repeating a million different things during the day. So I have little tricks like that I've learned over the years.
But I'm sure that that also makes it very interesting and rewarding to be able to help with a variety of different problems and just to keep things fresh. Do you ever see something at this point? I mean, you've been doing it for a little while now. Do you ever see something that you've never seen before in terms of a speech challenge or a unique speech impediment? Or have you seen it all?
I don't know. I don't know if I want to say if I've seen it all.
Yeah.
Um, Most recently, I have a little girl who, she's very bright, and she's been giving me a little bit of a run for my money with her behavior. So she's really exhibiting some task avoidance and refusal, and she doesn't have like cognitive impairments that would warrant like that level of behavior. So I really had to go back and kind of think about tools that I could use with her. So it's been a while since I've seen something like that. So I implemented a token chart. It's like um, kind of like a one for one. She gets a smiley face and gets to work for I don't know, 5 minutes swinging on the swing. We have a room that has a swing here in it. So it was kind of fun to remember that some of that behavior management is successful
Yeah.
because now she's on a roll and we're past that. So, but for a little bit, I was like, oh my gosh, I've tried everything and it's not working.
Yeah.
Yeah.
So I know we're getting a little bit short on time, Shauna, but I want to make maybe a couple other points and then maybe end by asking you what the really good parts of your job are and the things you like the most. And I guess I'll start that by relating to something personally. So I also went to speech therapy. Well, I went to speech therapy when I was very young. I can't remember exactly when. I'm just going to ballpark it and say like somewhere between 4 and 7. And we were living in Tucson, Arizona at the time, and I really don't remember too much about it. I remember going to the university campus. So this
Mhm.
would have been the University of Arizona. And I remember the room being very bright and working with a young woman there. She probably was even maybe just a college student at the time. But the most important thing that I remember was that it was a really, really rewarding experience. And so I doubt if that's true for all kids, but it was rewarding for me because one, it was kind of fun. Like I've always been good at doing kind of homework and tasks. Like I always try to do the best that I can. And so I think even at that age, I use it as that opportunity. But the real reason that it was rewarding is that it really worked. Like I came in with a problem, and I think it was an R problem, like you mentioned. I was having trouble saying my R's. And I don't remember how long I was in speech therapy, but it effectively, like it cured it. And it slips back in once in a while. I will make a mistake and I'll revert back to that 5-year-old. But for the most part, it made things all better. So I would imagine that that doesn't always happen. You've kind of alluded to a trying case right now where that might not happen, but it probably happens in a lot of cases. That's got to be really nice, right?
Yeah, it really is. And the families I work with are so appreciative. I mean, we definitely have had situations in the past where I'm sure there were things on their side that trickled over to here in frustration, and um but I one of the kids wrote me a Christmas card, and she's really close to graduating. She's almost there. And in the Christmas card, I'm sure her parents helped her write it, but they asked if I would come to her graduation party. And because she's been here for a while and she's worked really hard and she is going to get all of her sounds. And so seeing that is amazing. And I have another little boy who we worked we've worked for a while, and something I said last session clicked with him, and his mom came in and he was like almost a completely different kid. And I was like,
Hmm.
I don't know why that clicked for him after all these weeks and months. And so he's probably almost done too. So it is very exciting. The kids we see do sometimes stay with us for some years, depending on what they have going on. I'm trying to think of another really rewarding example. Um, I mean, some of the kids have worked with are now in their 20s and in like older than that, I'm sure. And so getting updates sometimes from those families or bumping into them in the community is pretty cool too. So it is very rewarding. And when I start to get frustrated about the low reimbursement rates or the wait list and all these kids we can't help, it's usually if I haven't been in the office for a while and I'm like thinking about things. But the minute I get back here and working with the kids and the families, it does bring a lot of happiness.
Great. So one last thing. So you're still young. What
Thank you.
what's next for you? Are you going to try to expand the practice, or
Oh,
guess
so
what's the next step?
it's funny that you're saying that. So right now, I do have 2 open offices. One of the people left because she's pregnant, and the other person left. She was an occupational therapist and went a different avenue. And so as we get as I take the intake calls, and now that the boys are, I mean, my oldest is maybe he's gonna be turning 15. So I have it has crossed my mind to start growing it back up again, and then maybe potentially transition it to somebody else. I mean, I would love for it to keep serving Reno and having clinicians who want to be here, who are passionate in this setting. And it's not for everyone. I have hired people who, just finished out their clinical fellowship year and went another route. So yeah. So I guess, yeah, long term, I would love to transition it to somebody and have it still be a place in Reno, but I am not done yet. I'm here for a while.
That's great. Well, I'm sure that whatever your next step is going to be, it's going to be successful. So, Shawna, thank you again. This is a really fun and interesting conversation. It always is with the folks that we talk to, and I really enjoyed learning about what you do. And thank you.
You're welcome. I love talking about it. I really do. So if you need more, I'll keep talking.